Hello friends, this is Nishant Gautam, Associate Professor from the Department of Pharmacology, Laureate Institute of Pharmacy. Today we will study your chapter, that is the plasma volume expanders. And this chapter, for your convenience, I have divided into the three parts, and this chapter also belongs to your second unit, pharmacology of drugs acting on cardiovascular system. So we will continue and discuss about this chapter. So before to start this chapter, we have to know the simple definitions of blood, plasma and serum. So what is the blood? Actually, blood is a largest fluid connective tissue that circulates continuously around the body, allowing constant communication between tissues distant from each other. Whereas the plasma is a clear, straw-colored, watery fluid in which several different types of blood cells are suspended. And the pure plasma is what? It is a blood devoid from the blood cells called as the plasma. Whereas the serum, so what is serum? It is a plasma without the clotting factors is called as the serum. So here it is the basic definitions of the blood, plasma and the serum. Now let us discuss about the constituents of the blood. A lot of constituents of the blood is there, but here we will discuss about only the three important constituents of the blood: the plasma, RBC and the WBC. So let us start with the plasma. So what is plasma? We already seen in the definition and we know, and here I am discussing about some features of the plasma. It constitutes the 55% of the blood. It is a liquid part of the blood, and the main function of the plasma is the transportation. So plasma transports soluble food molecules, waste products, hormones and the antibodies. The second constituent of the blood is the RBC, red blood cells. The red blood cells constitutes the main oxygen carrying capacity, and 5 to 6 million per ml is there in our blood, and the main function of RBC is to transport the oxygen. The third important constituent of the blood is the white blood cells, WBCs. And WBCs present in our blood 4,000 to 13,000 per millimeter square, and they considered as two phagocytes and the lymphocytes on the basis of their function. So, before to know more about the plasma volume expanders, let us discuss about the normal volume distribution of fluid in the different compartments of the human body. Just see in this picture, it is clearly mentioned that the 60% of the body weight is the fluid, and this 60% of the fluid of the body weight is further divided into the three compartments. The first compartment is the blood, plasma and lymph, which is 5% of body weight. In equilibrium to this compartment, the second compartment is of the interstitial fluid, that is the fluid between the cells, is the 15% of the total body weight. In addition to this, the third compartment is the intracellular fluid, that is the fluid inside the cell, is the 40% of the body weight. So in this manner, in these compartments, the 60% of the fluid is divided, 5 plus 15 plus 14. Likewise, in equilibrium, in these three compartments, the total fluid, that is the 60% of body weight, is there in a proper channel and in an equilibrium. Now, we will discuss in detail about the distribution of this 60% of the total fluid. So, here we will discuss the 60% of total body weight, that is the 42 liter. 42, actually in some books it is mentioned 42 to 46 liter, but here we consider the standard, that is the 42 liters. So in a healthy adult, the total body weight constitutes the 60% of the fluid. It is further divided mainly into the two. The first one is the intracellular fluid. Intracellular fluid is 40% of body weight, that is the 28 liter, or also we can say 2/3 of the total body weight. Whereas the another is considered as the extracellular fluid. This extracellular fluid is 20% of body weight, that is the 14 liter. So note this point, 14% of body weight intracellular fluid and 20% of body weight is extracellular fluid. So 40 plus 20 is equal to 60% of the total body weight. Another fact, intracellular fluid is 28 liter and 14 liter is extracellular fluid. 28 plus 14 is equal to 42 liter. Another important point, this extracellular fluid also distributed into the interstitial fluid, that is the 15% of the body weight, that is the 11 liters. See the diagram beside this. Here this 15% of the body weight, that is the interstitial fluid, and this 15% is in the equilibrium with that of this body plasma and lymph, that is the 5%. So this extracellular fluid, 20% of body weight, is divided further into the two, 15% and the 5%. That already we discussed. And further, the 75 to 80% of extracellular fluid is in the interstitial fluid, and the blood plasma is 5% of the body weight, that is the 3 liter, that we will discuss. Then after the fluid distribution into the different compartments of the body, let us discuss about the distribution of electrolytes and the substances in those body fluids which are present in the different compartments. Let us focus on this table. Here I summarize about that three fluids: plasma, interstitial fluid and intracellular fluid, with respect to the milliosmolarity per liter of the water. So we calculate this distribution of electrolyte and we measure in terms of the milliosmolar per liter of the water. So these different fluids having the different composition of the substances like sodium, potassium, calcium, chloride, and the ionized form of the carbonic acid, that is the HCO3 negative amino acid, lactate and glucose. For example, the milliosmolar per liter of water in case of the plasma contains the sodium 142, potassium 4.2, calcium 1.3, chloride 108 and HCO3 negative 24. In addition to these, the amino acid 2, lactate 1.2 and the glucose 5.6. This is the distribution of the electrolyte. Likewise, in this table, we mentioned about the distribution of electrolyte of these substances in the interstitial as well as the intracellular fluid. So, then after these basic details about the different body fluids with respect to their distribution and with respect to their electrolyte content, let us discuss about the plasma volume expanders. So what are the plasma volume expanders? Actually, plasma volume expanders are those agents that have the relatively high molecular weight and boosts the plasma volume by increasing the osmotic pressure. If there is a decrease in this osmotic pressure or there is a decrease in the plasma volume in case of hypovolemic conditions, to treat such patients we are utilizing these agents are called as the plasma volume expanders. Further, they are also used to treat the patients who have suffered the hemorrhage or the shock. So, in short, plasma volume expanders are high molecular weight substances which exert colloidal osmotic or oncotic pressure and when infused intravenous retain the fluid in the vascular compartment. They are used to correct the hypovolemia due to the loss of plasma or the blood. Now, in continuation of this, let us go through the term volume expanders. So, what are the volume expanders? The volume expanders are the intravenous fluid solution that are used to increase or retain the volume of fluid in the circulating blood. Further, these volume expanders generally are used to replace the fluid that are lost due to illness, trauma or surgery. These volume expanders used to correct the hypovolemia due to loss of plasma or blood, but these volume expanders do not have the capacity to carry the oxygen. Then let us discuss about the types of plasma volume expanders. Mainly, these plasma volume expanders are categorized into the two categories. These two types of the volume expanders are categorized as the first category is the crystalloidal replations. So, as the name suggested, crystalloids. What are the crystalloids? The crystalloids are the aqueous solutions of mineral salts or other water soluble molecules. The crystalloidal preparations are the normal saline, dextrose, ringer solution, etc. Further, in detail about these normal saline, dextrose, ringer solution with respect to its composition, formulation, their advantage, disadvantage, dose, contraindications, we will discuss in detail. And in continuation of this, the second type of the plasma volume expander are the colloidal preparations. Also name suggested the colloids. As name suggests, colloids are the larger insoluble molecules. What are they? Such as dextran, human albumin, gelatin, and also the blood itself are best example of colloid. So about the colloid also we will discuss in detail with respect to the colloidal preparations which we are using as a volume expanders like dextran, human albumin and the gelatin. So among these two types of the plasma volume expanders, a big question arises that why colloids are better than that of the crystalloids. Actually, human plasma or reconstituted human albumin would seems to be the best. However, the former carries a risk of transmitting serum hepatitis, AIDS, etc. And the latter is expensive. Therefore, the synthetic colloids are more often used. The desirable property of the plasma expanders we will discuss later in detail. So before that, first we have to search the answer of this. Why colloids are better than that of the crystalloids? It is because of the fact that the colloids are the larger molecules are retained more easily in the intravascular space and increases osmotic pressure. So what happens? They more effectively resuscitation of the plasma volume. So due to this effective resuscitation of plasma volume by the colloids, they produces the good oncotic pressure as per the standard requirements. And also the duration of action is relatively longer than that of the crystalloids. That's why the colloids are better than that of the crystalloids. Then, in continuation to this, let us discuss about some features of the colloid and the crystalloids. First, discuss with that of the colloid. These colloids having the capability to increase the plasma volume or having the capability to exert the colloidal osmotic pressure or the oncotic pressure up to the mark as per the normal requirement. Also, colloid produces less peripheral edema, whereas only smaller volume for the resuscitation is required. And the most important is its half-life. The intravascular half-life of colloid is 3 to 6 hours. Then, in addition to this, on another hand, the crystalloids. Actually, the crystalloids are inexpensive and They are used for the maintenance of fluid and interstitial resuscitations. Some initial resuscitations is maintained by the crystalloids, and so they restore only third space loss, and also the intravascular half-life of crystalloid is only 20 to 30 minutes. So the important point to be noted over here is the half-life. The colloidal half-life is 3 to 6 hours, whereas the half-life of crystalloid is 20 to 30 minutes. And another important point to note, the colloid requires only smaller volume for the resuscitation. Then let us discuss about some desirable properties of plasma volume expanders. Some ideal properties of the plasma volume expanders. The plasma volume expanders should be isooncotic with that of the plasma, so that they should exert the oncotic pressure comparable to the plasma. Then the second ideal property is the plasma volume expanders should distributed to intravascular compartment only. Means they should remain in circulation and not leak out in the tissues or to be too rapidly disposed. Then the third ideal property is the plasma volume expanders should pharmacodynamically inert. And the fourth ideal property is the plasma volume expanders should not be the pyrogenic, and they should non-allergic and non-antigenic. And the fifth ideal property of plasma volume expanders, they should not have any interference with the blood grouping or cross matching. And the last ideal property is they should be stable, easily sterilizable, and they should be the cheap. Then let us discuss about the plasma volume expanders employed to treat the patients. Let us discuss one by one. We are using the human albumin as a plasma volume expander. The second is the dextran. Then the third is the degraded gelatin polymer, that is the polygelene. Then the fourth one is the hydroxyethyl starch. We can abbreviate as a HES, also called as the HETA starch. Then the fifth one is the polyvinyl pyrrolidine, that is the PVP. Out of these five, the first four are mostly used clinically to treat the patient as a plasma volume expanders. Now, let us discuss about the mechanism of action of the plasma volume expanders. The question arises how the colloidal osmotic or oncotic pressure is maintained by these plasma volume expanders, or how they exert this osmotic or oncotic pressure. Generally, what happens, these plasma volume expanders works on the principle of osmosis. That's why they maintains the oncotic pressure. But question is, again I am repeating, how? The answer is they increases the osmotic pressure by drawing the water into the plasma from where? From the interstitial fluid. And what is interstitial fluid and how much normal percent of interstitial fluid is there in our body? Already we discussed in the second slide. So what happens? This increased osmotic pressure is since responsible for the lost blood is replaced. So once the lost blood is replaced with a suitable fluid, the new diluted blood flows more easily, even in the small vessels. So as a result of these chemical changes, more oxygen is released to the tissues. That's why these plasma volume expanders are extensively used to treat the shock conditions also. So, before the discussion in more details, let us go through some important points like the plasma volume expanders relapses the fluid to increase the volume as the RBC is still sufficient to supply the oxygen. Another fact, the molecular weight of colloids determine their duration of action and ability to expand blood volume. Then the dextran, high molecular weight starch, have negative impact on coagulation and may induce acute renal failure or also the allergy. The colloids are classified into the two categories. The first one is the natural colloids. For example, albumin. The second is the synthetic colloids like gelatin, hydroxyethyl starch, polyvinyl pyrrolidone. So that's all for the day. We will continue the same chapter in part 2. Till that, revise the topic from the book. Have a nice day and thank you.